I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome back to another informative segment of Boomer Health at Home. I'm Susanna Upward, your host, and our guest today is Dr. Paul Fyco, MD, who specializes in the practice of ophthalmology, and we will be discussing eye health. Welcome. Thank you for joining us today, Dr. Fyco.
Thank you for having me.
We like to start our shows by having our guests tell us a little bit about themselves, and you and I have been chatting already, so would you mind sharing with our guests, our audience, a little bit about your background?
Well, I started out as a chemical engineer, combined it with an MBA, and went to Ford Motor Company. I was there 5 years. Along with me, there was a gentleman from Wharton School of Business and from MIT. First downturn, those two are gone. I said I wasn't going to wait around
for your turn.
For my turn to leave. So I applied to one school on the last week, and I didn't know that you shouldn't do that, and I got accepted, and it was the best thing I ever did.
And that was Wayne State?
Correct.
You're a local man?
Correct.
Good, good. And what made you go into medicine?
I always thought about it, but I didn't think I'd get accepted.
Really?
Well, it's not easy.
No, it's not. No, it's not.
I chased after my dream, and I caught it.
Good for you. And you've been practicing for 45 plus years?
Yes.
And then your other career on top of that. What's the difference between your role as an ophthalmologist and an optometrist?
Well, the big difference is education. To be an ophthalmologist, you first have to go to 4 years of medical school, a year of internship, 3 years of residency, and there are subspecialties that even advance it farther. And the big thing, you can diagnose, you can treat, and you do surgery. I don't want to downgrade the optometrists. Right. They do a good job, but they are limited in what they can do. To work together is fine, because if they see a problem or somebody that needs surgery, they send them to us.
They can refer to you. So optometry, what do optometrists do? Do they prescribe the glasses?
Glasses, contacts, and they're doing some diagnosis too. Okay. But they can't act on most of the diagnosis.
Right, so then they in turn would refer to you. What hospitals, you mentioned that you've been on several hospitals over the years, and what hospital are you currently affiliated with?
William Beaumont in Royal Oak.
Wonderful.
And I did that because I think it's the best hospital in the area.
Oh.
Well, it is.
I think you're right. I agree. I agree. How has the business of healthcare changed in the last 30 years?
The biggest thing is restrictions.
Yeah. Restrictions from
government, from the insurance companies, from the hospital.
Right.
The paperwork is unbelievable. The hospitals are more, I got to be careful what I say, but they're more interested in finances than anything.
Right. Well, they're a business.
That's correct, but about 3 or 4 years ago, they came to us and the plastic surgeons and said, we're going to cut off your privileges because you're not making enough for us. But after 3 years, we would have developed our own surgical centers. We have a anesthesiologist, we have a internal medicine person, and we can, people in the hospital often rotate through eye surgery, and some people don't like eye surgery. Here, everyone that we have wants to be there.
Wants to be there, right.
And after 3 years, they asked us to come back, and we told them we were very happy where we are.
Well, you're seeing more and more of these off-site surgical centers. So,
Absolutely.
GIs are doing GIs.
You don't have all the overhead.
That's right. That's
You
right.
can
And they're
be-
in and out.
You can be more efficient.
Right. How have the diagnostics changed just in the last 10 years, let alone over your career? How have those changed?
The biggest thing is electronics and lasers. We used to do the visual field by hand. We now have a machine that does it. We have a machine called an OCT that can visualize all the 10 layers of the retina.
Wow.
So when I look in the eye, I only see the surface. They'll see things going on underneath that haven't come out yet.
Yeah.
And lens power, we could not as accurately diagnose what lens you want. With the machines now, we can give you any prescription you want.
Wow. And I would think that would help you diagnose diseases sooner.
Of course.
So you can get treatment much sooner.
Right.
How about the procedures? And you mentioned the technology, but have the procedures improved?
Tremendously. Until after the war, we didn't have sutures fine enough. When you did cataract surgery, the suture and the needle wouldn't stay in the tissue.
Right.
So you had them at bed rest with sandbags next to them. That has gone.
Right.
Small sutures have helped tremendously. Type of surgery we do. We used to open the eye 180 degrees, dilate the pupil, take the lens out. Then you needed thick glasses. When we got contacts, we thought we died and went to heaven. But from the World War II, the fighter pilots in England would get fragments from the cockpits in their eyes, and the eye tolerated. So we thought, well, maybe we could put something in the eye, an implant. And we had troubles at first.
Sure.
We put it in front of the iris. When the iris would open and close, it could rub on the lens and cause some troubles. We put it in the pupillary opening. That was not good. And we finally decided we could put it behind the pupil. And
that worked?
Yes. And we used to open the eye 180 degrees and put sutures. Now we open it 2.75 millimeters. Instead of taking the lens out, you make a round opening called a capsular rhexis. 2.75 suture, incision at the cornea and limbus area. Put a machine into those two openings, suck out all of the interior of the cataract that's forming a cataract. And then we have a bag, and we have a lens you can fold, put through both of the openings, put it in the bag we formed, and it opens. You don't. We can do it without putting you to sleep. We do it without putting an injection behind the eye. We use topical, and the anesthesiologist will make you calm, so you don't.
Right.
You let us do it.
Right.
And since you've done less cutting on the eye, the vision will be usually better that day and in a week.
And improve. And I would think recovery would be
much less.
Much less problems with that. That's interesting. What age, we talked about this a little earlier, typically what age do people start experiencing changes in their vision? For me, I swear to God, the day I turned 50, I needed reading glasses.
Well, usually it's earlier than that.
I know,
were lucky.
I was lucky.
It's usually about 45. You used to hold a vision here, then here, and what is that arm's length? We give you reading glasses, and that's occurring because the lens in the eye grows throughout life, and it's not as pliable as it once was. We have a muscle that adjusts the eye for near and far. It can't adjust for near anymore. So you start out with a weak lens in the middle 40s or early 50s, and it has to be increased every 2 years plus or minus till 65. Then it stabilizes.
Oh, so good. So I only have a few more years and my eyes will be stable and I'll just wear the same glasses. Is that what you're saying?
Well, they'll be very similar.
Good. Good. So let's talk about some common eye or vision problems that seniors experience.
Well, the big thing is macular degeneration.
Yeah.
People are living longer, and A lot of macular degeneration is caused by diabetes. When we got insulin, we were very proud of ourselves. These people live, but they're getting all kinds of problems. And one of the big problems is cataracts and damage in the eye from bleeding.
Yeah. What causes the macular?
It's genetic usually, but it runs in families. But diabetes is the big thing.
Really? Okay.
Diabetes is a terrible illness.
It's a terrible. Not only does it affect your vision, it affects your limbs.
Right.
So many other things. And let's talk about glaucoma. You told me earlier that that could be familiar or genetics too.
It runs in families. I'm the only one in my family that doesn't have it.
Oh, you're lucky.
I think I was adopted. But it does run in families. We're getting much better treatments. When I started, we had 2 or 3 medications. They made the eyes red and irritated. That's not true anymore. We have good medications, and we have increased surgical methods to help.
I didn't realize that. And also, typically, you don't know. Like, I wouldn't know if I had glaucoma unless I went for my annual exam.
It's painless 98-99% of the time. If you get angle closure glaucoma, pressure goes up, vision gets blurred, pain is tremendous.
Oh, eye pain.
You do it that day. But glaucoma is an interesting illness. We're finding more and more out about it.
Yeah, it sounds like it. It sounds really real interesting, and I pray that I don't get it. My mother has it, and I think my dad might have had it. He had cataracts. I don't remember. What are some typical warning signs that a patient should be aware of, and then make sure that they follow up with their physician? I shared with you earlier that I experienced a year or so ago these bright lights flashing in front of my eyes, and I didn't think anything of it until I talked with my husband, and he insisted I go see my ophthalmologist.
Right. If you have a tear in the retina, you get flashes and floaters. We have to dilate and look everywhere to make sure there's not something, a tear that has to be treated either with surgery or with the laser.
Speaking of dilating, why do you have to dilate?
2 reasons. We got to take a good look at the lens.
Okay.
And you've got to see the retina.
Oh, okay.
Because way out where the retina attaches to the sclera, or to the sclera, you could have damage going on, and it can be treated earlier. Lattice degeneration, things like that.
Okay. It's uncomfortable. I find it very uncomfortable when I have my eyes dilated.
You're right. Women complain about breast exams, men complain about prostate.
Exactly, it's a necessary evil.
Right, but dilating is the only way you're going to get a good vision of the retina and make a diagnosis.
So some of the things that I was thinking about that should be reported to your ophthalmologist, and I see an ophthalmologist regularly because I've had some vision issues, not vision, but some eye problems through the years. So loss of vision, a sudden blurry or hazy vision, some double vision, pain in your eye.
Pain, sensitivity to light usually indicates there is inflammation somewhere.
Okay.
Iritis, uveitis, things like that.
Halos around the lights. And we talked about how I'm getting floaters now. I'll close my eyes and I swear to God I see like bats flying across my eyes.
Right, but it gets to be your friend if there's nothing else going on.
Yes, it's not scary anymore.
In church, if it's a bad sermon, you can find your friend. But it is annoying because if you're reading, one letter can be missing in a word.
That's right. Yeah.
But you learn to keep your eyes still and it floats out of sight.
So we talked earlier about Cicero and Matthew and Shakespeare saying that the eyes are the windows to your soul. And you shared with me about how if we didn't have vision, right,
there would be, I don't know if we could survive.
That's right.
Matthew was interested in the soul, so I think he made that connection. Shakespeare
was the romantic, right?
That's what I was going to say, romantic. Now Cicero's a little different. He goes back about 100 years before Christianity, and he was a thinker, an orator, and when you think about it, the most important thing you really got is vision.
It's true. You lose that, you lose quite a bit.
That is correct. Right? You can't do any job.
It's very precious.
Education, everything is difficult or impossible. So he honed in on that, and he was right.
Right, right. What made you go into ophthalmology? Of all the pieces or the parts of medicine you could have practiced, what made you go into ophthalmology?
One of my best friends, all he talked about was ophthalmology. I said, I want to be a real doctor. None of that is, there's one and two, which is better. I took an elective with him. I'm in ophthalmology, and he's a cardiologist. So
that's funny.
Well, you don't know where you're going.
Yeah, you don't. You have an idea.
Keep your mind open.
That's right.
And the first cataract I ever saw done was by Dr. Hesberg. Mm-hmm. Hesberg is an unusual man. He designed lenses. The auto show for these stylists at the Etzel Ford Estate, he runs that, he just did. And when he finished, he said, if you're lucky enough to get a residency in ophthalmology, it's the queen of all the specialties. And he's right. I agree with him.
So you've never once regretted going into ophthalmology? No. And I'm a nurse, and I've never regretted that either.
And the research and the new things that come out, ophthalmologists are very aggressive and very good with, how shall I put it, research. So one of my friends married an internist, and he comes to our meetings. He says, I can't believe all the things you do. And she is an internist that went into ophthalmology.
Oh, interesting.
And she said you have to take your re-exams every 10 years. She says, very little has changed. That's the type of medication they're using. That's not true with
ophthalmology.
No, we've gone from Kitty Hawk to the moon.
Oh, that's interesting to know. So if you are a family member and you're noticing, my mom's in her 80s now, what are some of the things that I might pick up on with vision changes with her?
First thing is driving at night. If she drives, she'll tell you seeing the street signs, and she doesn't like to drive at night. Mm-hmm. But then things around the house, reading it becomes difficult. Mm-hmm. When they walk around, they're very careful because they don't want to fall, break a hip, and you're in
right, and then you're
and trouble reading, seeing the food on your plate.
Okay, can or do you recommend that seniors wear contact lenses?
If they've been wearing it for years, fine. Mm-hmm. But as you get older, you have arthritis. Right. You don't see up close.
I told you my husband's been wearing them 40 plus years. He can do them with the lights off.
He can do them in the dark without any mirrors, without anything, because he can do it. Right. Unless arthritis gets to him.
He's got that memory muscle.
Of course. Of course.
Who's a candidate for LASIK surgery?
LASIK surgery has been a revolution, but the ideal person is someone that is. We correct nearsighted, farsighted, and astigmatism. Those that are in the medium amount of each do better. If you get to very high minus, you get to very high farsightedness, it can be a problem. I didn't like it at first. The military wouldn't take you. Now the military does more LASIK than anyone.
That's what you said.
And the people have to know what they're buying, because if you're nearsighted, you can always see up close.
Right.
With LASIK, if you want to see well at a distance without glasses, you won't see up close. And that's good until the 40s,
right,
early 50s, but after that, as you know, you have to work.
Yeah, I need my readers. Well, and I shared with you, my daughter, this is an elective surgery, so insurance doesn't cover it. Right. And my daughter, who lives just outside of New York City, came to Michigan to have hers done, and she's been very happy. It was an in and out surgery, and I don't remember her complaining of any pain other than she had to be quiet for an afternoon.
Right.
But her vision has improved 100%. She doesn't need glasses anymore, contacts, but she's wearing readers at 40. Now, does that increase the need for readers?
Usually not.
Usually not?
Well, it depends what you're left with. And if you don't get perfect vision, in other words, you're a little nearsighted or a little farsighted when they're done, they can redo it.
Oh,
or not redo it, they touch it up.
Okay. That's interesting. So how long does that last? I think you mentioned earlier that it's not a forever thing, right?
For most people, it's not. It's gotten much better because of our technique. But I think you're good for 20, 25 years.
Well, that's good to know. I'll tell her that next time I talk to her. Let's talk about sunglasses. I shared with you that I wear them all the time. I have blue eyes, and for whatever reason, the sun really bothers me. Do you recommend that people wear them?
Well, we're worried about the UV light.
Right.
Texas, California, Arizona, I would wear them. But in this area,
And you said you don't even wear them.
no, I don't.
Okay.
Fair complected blonde people, they're much more sensitive to light. If it makes you comfortable, and we're not really settled in how much damage UV does, I'd wear them.
So what is UV protection, and what should we know about it?
Well, UV protection is the lens that filters out the UV lenses, and as I said, it depends on
Where you live,
right,
how much sun you get.
right. But
I'm in the sun a lot because I'm a runner.
Correct.
So I wear my sunglasses even on a cloudy day like today.
and as I said earlier, sailors are on the water and you get a lot of sunlight. Certain states in the country get a lot of sunlight. When I go to Florida, just because of the brightness, I'll wear them, but otherwise,
Good for
I don't
you.
wear 'em.
And you've got blue eyes too. Are there any vitamins or supplements that are helpful for eye disease or preventing eye disease?
prevention is just get a good
Multivite?
multivite that covers everything. That'll do it. You don't want to treat something that you haven't seen yet. Ocuvite, there's nothing that prevents it.
Oh, that's interesting. So there's nothing that will ward it off?
No.
But as you mentioned, Ocuvite, does Ocuvite help it from progressing?
Correct.
Okay.
Two types of macular degeneration, dry and wet.
And that's where you would use the Ocuvite?
I use Ocuvite, and we have a screen, it's an Ambler grid that you look at it, put on the refrigerator once a week. If you see the lines bending, that we worry about, because dry can become wet. Wet means blood vessels are growing in, and that has to be treated.
Oh, that's fascinating.
Because if you get bleeding in the eye is part of the brain.
Right.
Doesn't like that.
Well, and we talked about the eye and the brain connection, how important it is.
7 of the 12 cranial nerves are ours.
That's right. That's interesting. What foods help better vision? As we talked earlier, we were told to eat our carrots.
Well, carrots are for night vision mainly, and
I better start eating them because I'm struggling with night vision.
well, that's for other things, but Ocuvite helps as far as stabilizing things, but you should be seen at least once a year, and with the Ambler grid, if you have trouble, you want to know. If you go from dry to wet, the retina people will use lasers or give injections or medications that. When people were having cancer treatments, we found out that vision or the blood vessels in the eye that from diabetes that were bleeding got better.
Oh, that's interesting.
It is interesting. So we found out that we inject a very small amount in the eye, and we can prevent bleeding.
Oh, that's interesting. Does it stabilize it or almost sclerose it, almost like?
Well, you could reach a point where it's stable, and you'll maybe be seen once a year.
Okay.
But you always have to be looking at the Ambler grid. If you see any changes, we have to know. And smoking is terrible.
Wow. Yeah.
It constricts blood vessels. And people with macular degeneration and smoke, they're getting many more injections in the eye.
Ugh. And those are right in the eye, my mother-in-law told me.
Well, it's in the eye, yes.
Yeah. I'm a baby, I couldn't.
It's a part of the eye that doesn't have a retina there, so you're not damaging it.
Is it painful?
Mentally, it's very difficult.
As we're talking about it, I'm thinking, ooh, that hurts.
But it doesn't hurt that.
Yeah. Ugh. So foods, let's talk about food. So we mentioned earlier that, as I said, carrots, but also you mentioned the green leafy vegetables.
Green vegetables.
So
right.
your spinach and your kale and cabbage,
all
those good
the
things.
things you like.
Yeah, all those things that I like. I'm a vegetable person. I love a lot of veggies. And hopefully that's going to help with my vision as I age. So looking ahead in 5 to 10 years, what do you think is going to be the most remarkable breakthrough in ophthalmology?
If we can prevent things, if we can prevent cataract formation, it'll save surgery, it'll save a lot of money as far as going to the hospital.
Insurance costs.
Insurance costs.
Deductibles, et cetera.
Then the same thing on glaucoma. glaucoma can escape treatment just like diabetes can, so there's a lot of medications that can be involved. And glaucoma, cataracts, and macular degeneration. If we can control those better or eliminate them, it's going to be wonderful.
That's good to know. Well, that brings us to the end of another show, and I want to thank you, Dr. Fyco, for joining us and spending the morning with me. You've given us valuable information. I know it's going to help me. I'm going to go home and share some things with my husband because of his family history. And I'm also going to make my appointment to my ophthalmologist because I haven't seen him this year, so I'm about 6 months delayed. So
Well,
thank you again. I'm Susanna Upward. I'm the Director of Nursing at AmeriCare Home Health, and you have been watching Boomer Health at Home. Thank you.